Hi, Paul. I'm Diana, student massage therapist. How are you?
Good.
So today I'm going to be performing a couple of tests. I'm going to be starting off with thoracic outlet syndrome. The reason I'm doing this test is to check your radial nerve and radial pulse. The benefits of doing the test is so I can focus. So if you are positive, I'm going to focus my treatment on treating the surrounding areas so I can try and reduce any of the reoccurring symptoms and compression to the radial nerve and radial pulse. The rest is that you might feel reoccurring symptoms because I'm going to be performing this test. If you are positive, the reoccurring symptoms will occur, so you might feel some pain or some discomfort somewhere. Do you have any questions before I start each one?
No.
Okay. So the first one I'm going to do is called absence. So I'm just going to thank you. So I'm going to take your pulse, and I'm going to bring your arm back, and you're going to, bring your arm back, and you're going to look towards me, and take a deep breath in. So you aren't positive for this testing. If you were positive, what happened is that your pulse would either go away completely or it would diminish, slow down a little bit. So I was testing your anterior and your middle scalings. Now I'm going to test your now I'm going to perform clavicular testing, which is going to test your first rib and your clavicle. So I'm just going to hold your pulse and bring your shoulder down and bring it back a little bit. And same thing, take a deep breath in. So the same thing, you can relax. So you're not positive for this test either because your pulse did not go away or diminish. So now I'm just going to perform Wright's maneuver. So just taking your arm all the way up. And if you can just take a deep breath in. So you aren't positive again for this testing. Your pulse did not go away or diminish. And for that testing, I was testing any compression that could be occurring underneath your pectoralis minor. And now I'm going to be performing Allstead's. So taking your arm, I'm going to do it with my thumb, and bringing it back. And if you can just look away from me. Take a deep breath in, Okay. So same thing, you're also not positive for that. Your pulse did not go away or diminish. And that was testing the cervical rib. And now I'm going to do Allen's. So just taking your arm and going to the side and looking away. And take a deep breath in. And no, so your pulse did not go away either or it diminished, so you're not positive as well for the test. If you were positive for any of those tests, your pulse would either go away or it diminish slowly. And the last testing that we just did, it was testing for your anterior scalings. Another test for thoracic outlet is also called Ruth. So I'm going to get you to bring your two arms to your side and putting your fingers like this together. So and just try to be a little higher up, please. There we go. And do you feel any sensations by your shoulder area or pec area? No. Okay, so what would happen is that you would hold this at least for 5 to 3 minutes. And what would happen is that if you're not able to hold it, it's because you have some compression occurring up here. So therefore it become a positive testing. So now I'm going to go to, now we're going to go into carpal tunnel. So for carpal tunnel testing, carpal tunnel testing is your radial nerve as well. The reasons for doing this test is to check if you are positive, and if you are, we're going to try and focus the treatment on the areas to decrease any tension that you might have feeling and any recurring symptoms that you are having. The rest of this is that by doing the test, you might feel some tingling. Sorry about that. You might feel some tingling as well as some numbness in your fingers because this positive testing for this is your thumb, index, middle finger, and the lateral of your ring finger. So you might feel some of those symptoms occurring. Do you have any questions before we perform them?
No.
Okay. So we're going to do phalanx. So I'm going to bring your arms like this. And do you feel any tinglings or numbness occurring by your thumbs, index, middle finger, or lateral finger? No. Okay. So you can just relax. So basically you would have felt, if you were positive, you would have had tingling occurring on those 4 fingers. Now reverse phalanx is just bringing it down. Excuse me. Yeah, like that. do you feel any numbness or tingling occurring on any of those fingers I was talking about?
No.
Okay, so you can just relax. So same thing, a positive testing for that would be your thumb, index, middle finger, and lateral ring finger. And then the other one is called tenelles at the wrist. And then there's also tenelles at the elbow, which we'll do in a second. So we're just going to relax, and you can just relax your fingers. So I'm just going to tap any sensations, any tingling, numbness occurring.
No.
So now we're on the thumb, index finger, middle finger, ring finger. Okay.
No.
And now we're going to do tenelles at the elbow. So I'm just going to bring this up and just look so relaxed so I can find space. Okay, right here. So same thing. Just let me know if you feel any tingling or numbness. Any tingling or numbness?
No.
Okay. So if you were positive for any of those testings, you would have tingling or numbness at your thumb, index, middle finger, or lateral ring finger. So now we're going to go to performing your piriformis testing. Actually, yeah, we'll do your piriformis testing. We'll just get you to lie down.
On my stomach?
Actually, yeah, so we'll do it with the stomach first. It doesn't matter which way. Yeah. So I'm going to get you to bend your knees. And for this testing, it's to test the length of your piriformis. So basically in a couple of minutes, I'm just going to get you to drop your legs to the side. And the reasoning, so just go straight. The reasoning why I'm doing this is just to test if you have any pain or discomfort occurring at the piriformis. The benefits of doing this is to see, so if your leg doesn't go, if both of them don't go the same length, it's because you have your piriformis is tight. Therefore, I'm going to focus the treatment on trying to treat it and trying to loosen it up and release any trigger points that you may have in there. The benefits, those were the benefits of doing that. And then the risks is that you might feel some pain or discomfort, or as well as recurring symptoms if you also have any sciatica issues, okay? So when you're ready, you're just going to spread your feet apart and just let them drop. Okay. So from my view on your left, on the side, you are a little tight, so this doesn't go all the way compared to this side. So that meaning that you are tight on the side, so you are a positive. And then if you can just put them together, and then if you can just come on your side facing me. So we're going to get this leg straight, and we're going to bend this knee. Yeah, so just like that, and on top of it. Perfect. So what I'm going to do for this test is I'm going to be pushing down, and you're going to be feeling some pain occurring around your bum area. And if you do have pain in that area, that means because you are positive for this piriformis testing, as well as it can have some recurring sciatic issues too, okay? So when you're ready, I'm just going to stabilize you, and I'm just going to bring your leg down, and you okay? Okay, just relax. I'm going to push it down, and you just let me know if you feel any pain on the back of the area, okay? Any pain? Any pain or discomfort?
No.
Okay, so you're not positive for that. If you were positive for that, you would have pain being on your buttocks area, as well as a reoccurring pain of sciatica. So we're just going to get you to, actually since you're laying down, we'll just do the upper tension testing. So I'm going to get you to lay down your back. So with the first one, I'm just going to bring your arm back. Sorry. So I'm going to bring it back. I'm going to bring your hand back. And if you can look away, do you feel any tingling? Okay, so,
yeah.
So you are positive for this test. So basically what's happening is that these tests, these tests are testing your median ulnar and radial nerve. So basically, from performing each test, you might feel some tingling, some tingling or some recurring symptoms happening. I'm so sorry. Sorry. Okay, there you go. That's better now. So you might feel some recurring symptoms happening. So the benefits of doing this is that I'm going to be treating the area and trying to relax any of the muscles that are occurring near your radial ulnar and median nerve. The risk is that you might feel some tingliness, how you just felt for the first hypertension testing number 1. So that's like the risk of this, that you might feel like some pain, some discomfort, some tingliness if you are positive. If not, then usually don't feel anything. But just so you're aware of it. So we'll just perform that again. So upper tension testing number 1. Just bring your arm up and then bringing your hands back. And then I'm going to get you to look away. And you're going to let me know if you feel any tingling, numbness anywhere.
Yep.
You do. Okay, so exactly. So you be positive for that one. So now number 2 is down here. And we're going to bring your hand back. And if you can also look away. And do you feel any tingling, numbness happening?
No.
Okay, so you're not positive for this testing. What would happen if you were positive? You would also feel some tingling, some numbness happening at your median nerve. So number 1 and number 2 upper tension testing was to test both your median nerve. Now to test your radial nerve. So it'll be down here. We're gonna, other way, and then we're gonna radially deviate you this way and push you back, and you're gonna look away, and you're just gonna let me know if you feel any pain, tingling anywhere. No. Okay. So you're not positive for this testing. So if you're positive, again, you would be feeling some tingling, numbness, pain sensation occurring right at the arm area. So from your shoulder all the way down. And then for your last one, number 4, which is for your ulnar testing, I'm just going to get you to bring your hand to your ear. So just like that. And then I'm going to be pushing down. So you're just going to let me know if you feel any pain or tinglingness.
A lot of it.
Okay. And if you look away?
Yeah.
Okay. So you are positive for that testing because you did feel some tingling, numbness, like some discomfort on that arm from doing the testing. The other testings that we are going to perform are, I'm going to get you to lie down on your side again, sorry. This is for your femoral testing, so I'm just going to go behind you. What's going to happen is that I'm going to bring your leg back, and this is testing your femoral nerve. And the risk of doing this testing is that you might have some pain and discomfort on the front of it because I'm going to be pulling back and it's pulling on the nerve. The benefits of doing this is to try and treat the area to prevent some reoccurring symptoms to occur. So by treating it and relaxing all the muscles. So I'm just going to perform it. So just going behind you. And just grabbing your leg. Sorry. Okay. So I'm just going to bring it back and just relax. And do you feel any pain, any discomfort anywhere on your anterior thigh?
No.
No. Okay. So you're not positive for this one. And then if you can just go on your stomach. This is another test also. So it tests your leg. So I'm going to bring you passively. I'm just going to bring you down. And you just let me know if you have any pain occurring on the front. This is the same thing as testing your femoral testing.
No.
Any pain or discomfort?
No.
No. Okay, so you're not positive. If you were positive for both of those, you would have pain occurring on the front of your legs. And then for the other ones if you can just sit for me. There are 2 more testings and then we're done. So we're going to get you to put your thumb and your index finger nail to nail basically. And we're just going to hold that. And this is testing your median nerve. So we're going to push your fingers up, Yeah, okay. And this is testing your median nerve. And you're going to let me know if you have any pain, discomfort, anywhere happening by the median nerve.
Oh, she was a little tight in the fingers there.
Tight, but no pain in the forearm area. Okay, so you're not positive for that testing. If you were positive, you would be feeling some pain in that area. And then the other thing that we're going to do is... It's okay. And the other thing that we're going to do is the pinch grabbing test. So I'm going to get you to hold your fingers, and you're going to hold that paper, and I'm going to pull it away from you. And if your fingers are weak, what's going to happen is that when I pull it away from you, it's going to slide right away. And if they are strong, then it's going to be like a tug or pull on it. Okay. Something. Okay, so you aren't positive for this testing. So you aren't positive because what happened is that I was able to take it away from your hand. And do you have any questions?
No.
Okay.